Good afternoon. Thank you for tuning into our webinar today. We're going to talk about one connected medical home with BrightSquid Secure Mail. My name is Jeff McKay, and with me is Mark Ayre, the BrightSquid Director of Customer Operations. Hi, Mark.
Hey, good afternoon. How are you today?
I'm good, and hopefully everybody else on the call as well. We'll keep you on mute, but if you do have any questions throughout, please feel free to put them in the questions tab in the GoToWebinar control panel, and we'll get to as many of them as we can at the end of today's session. So let's dive in. And Mark, do you want to take us through the history of BrightSquid? You've been around longer than I have, so.
Yeah, I'd be happy to. So Bright Squid was founded in 2008, pardon me, here in Calgary by a group of fellows who were trying to make a better way to communicate. Now, we get a lot of questions about where did the name Bright Squid come from. There's a long story and a short story. The short version is the radiologist named the company because the connectivity of squids and the luminescence of a certain breed of squid. He liked the sound of that because you can illuminate the dark spaces of human anatomy as a radiologist and then use the connectivity part of the squid as a way to communicate. So that's kind of where the name came from. So in the years since we were launched, we've brought on about 85,000 professional users. I think over 400,000 patient users. I'm pretty sure that's getting pretty close to 500,000 by now. And we're sending a couple 100,000 messages a month on behalf of our clients. We also introduced some other features built around the same secure email platform, and that's our appointment reminder service that integrates directly into medical EMRs. So let me know if you have any questions about that. We also offer a bulk messaging program, which allows you to send secure messages to a large list of recipients all at the same time. So rather than sending messages one at a time to one, two, or three patients, you can send literally thousands of messages at the same time through a template, kind of like what you might be familiar with the Microsoft Mail Merge functionality. That bulk messaging affords itself to screening programs where you can contact patients about a particular healthcare issue that you may want to bring to their attention. We've recently been doing this with diabetes screening, breast cancer awareness, as well as some notifications about vaccinations that might be important to your patient community. So let me know if you want to learn more about those things. And then the last thing on the list, one of our newest features is secure online forms, making it easier for your patients to respond back to you in answer to specific questions. So they can essentially fill in an online form without having to download or manage any documents on their side. And again, happy to talk about that offline if anyone has any specific questions around that. Now, Secure Mail is used across the CFPCN medical home. It has been throughout the last half a dozen or more years, and it will continue to be used by the groups listed here. If you're part of the CFPCN and you're looking to communicate with members of these departments, your Bright Squid Secure Mail account is going to be your best channel for those conversations. So it's important to keep your account up and active so you can continue to use it for not just the people listed here on the screen, but also communicating directly with your patients and colleagues who may be outside of the CFPCN network, a specialist, for example, or a lab or insurance folks.
Thanks, Mark. And I think a lot of insurance organizations in Alberta and beyond are joining the Secure Mail network because it's a much easier and more secure and compliant way to communicate outside of email that is often typically used by those organizations. So it's good that they're coming on board. Well, I'll talk a little bit about what communications are helpful and what communications are not. These are the things that we hear back in terms of what's frustrating about communications within the clinic environment. The big one being there's too many channels to manage. I've got to look at my phones, I've got to check the emails, I've got to fax things, I have to mail stuff. The biggest request that we get is that clinics want a channel that they can use with everyone, patients and professionals, to keep that all together in one place. And that's a big part of the reason why Secure Mail does that and has for years. When we look at some of the other things in here, we can address those, and we'll certainly talk them as we go through. When we talk about Secure Mail, it's really about doing health data delivery right. And that was sort of the founding tenet. When the radiologist was trying to share images with experts for consultation. It was very difficult. It could take days or weeks to send over some images that were burned onto a DVD, if you can remember those, or a CD, as well as maybe even a thumb drive for storage, but that might show up broken. And oftentimes he had to move forward without all of the information he needed to make a proper decision. So that was about getting the information properly. And so speed is part of it, but compliance is also a big issue. With SecureMail, we can connect the entire circle of care. So all of those organizations Mark was talking about within the PCN, all of the supports for your clinic, you can communicate with them and beyond. If your patient is, for example, working on treatment for a motor vehicle accident, maybe you're working with a chiropractor and a dentist and a few others, insurance companies as well. It's all being coordinated with lawyers, maybe even can all be communicated with on one message to keep everybody updated. Or in cases of palliative care at home, you can talk to the nurses and caregivers all in one channel to give updates or get updates about a patient's condition and make decisions on the go in that way. So we can unify patient engagement across the circle of care. We can automatically prevent privacy breaches with SecureMail, things like BCC mistakes, CCCing emails. It does happen in Alberta. It happens more than we would like. Misdialed faxes are one of, or actually in Ontario in 2022, they were the largest cause of privacy breach in Ontario. Ransomware is a bigger and bigger threat, unfortunately. That all gets blocked with SecureMail. There's no spam. So even if you're using something like Microsoft Outlook encryption, which isn't accepted as compliant by the OIPC in Alberta, you're still working within an email environment where ransomware is a possibility, where phishing attacks are a possibility, where spam is going to clutter up your inbox and make things difficult to find. With those programs, you can't earn compensation. So there's billing codes that can apply to SecureMail communications, as well as other efficiencies. So we can get rid of paper. Some of the things that Mark talked about in the beginning, such as secure online forms, all that kind of stuff, we can get rid of paper, we can get rid of extra process work, and that helps reduce costs as well as efforts. Everybody's a lot less burnt out, and we're not wasting so much time and resources. And when we talk about exchanging data properly, and when we get back to the initial concept of SecureMail, you can think about the SQUID as sort of that classic cloud diagram Mark was talking about with the tentacles for connectivity. When we talk about data done right, it's about making it available. And interoperability is a hot topic now. We're looking at how we can support primary care clinics with auxiliary care, with allied health professionals, with support groups, with the PCN. And this, the Interoperability Saves Lives report came out last year. It was published in Alberta. And this quote is very telling of what it found. We know we need to be able to share data easily and quickly, and SecureMail allows you to do that with anyone. So it does give that level of interoperability with any professional, as well as caregivers and patients. Now, here's an illustration of what can happen if you're a patient, or sort of what communication or management within the circle of care looks like now. And it's a very complex, it's hard to track. We can't really tell what's going on. As a patient, you can look at that and know that it's very overwhelming. And how do we track all of this? And who's responsible for all of this? And how do we know what's going on? And the reality is, this illustration is unfortunately the result of an investigation into a case where the patient unfortunately did lose his life because information wasn't flowing in the ways that it needed to be. And he is the first patient in Canada to have an inquiry rule that it was really just mismanagement of information that caused this patient's death, unfortunately. And that was here in Alberta. Now, when we talk about harm to patients, we can talk about harm through care, we can talk about privacy harm, but when we have poor communication systems, there's data-related harm where patients aren't going to get the care they need. Maybe there's mistakes because of breaches, that kind of thing, but physical and emotional damage, certainly. Legal rights to care, cultural rights, because we're not treating them properly, we're not using the information properly. And situations like this really lead to population harm, but also system harm, because the healthcare system can't operate efficiently and effectively this way. It's very expensive. We're adding costs to the system. We're creating a ton of burnout with people trying to manage this. Dr. Affleck, who created this slide, talks about not being able to get the information and not making the right decision, and the harm that happens to patients because that information was missing adds to the burnout. And he said when bad things like that happen, we just want to quit as doctors, and that makes total sense. So when you look at how we're contributing to the solution for this, or if we're supporting patient portal fatigue, you can see if a patient has to manage all of this outgoing and inbound communication, where do I go? Where do I get this information? Am I getting stuff from the mail? Is it on the phone? Sometimes it's email. Sometimes it's a portal for clinic. And imagine if there was a different portal to get your information or communicate with each one of these clinics in your circle of care as a patient. Try to remember all the login, all the websites to go to, all the apps to go to, what's my password for all of these things is very complex, which leads to confusion, a lack of adoption on the patient's part, and also, worse in this case, death, unfortunately. So there's a lot that can be done to make this better, and that's really where SecureMail fits into the medical home, and that's why SecureMail was chosen by CFPCN to be the communication channel across all the supports in the medical home. Team-based care is best practice. We can go on the Alberta Doctors on the AMA website, and the College of Family Physicians of Canada says a high-performing team is essential. And communication is a huge part of that. So we need to make sure that everybody's able to communicate, get the care information, care-related information that we need regarding patients to get them the treatment they need. And team-based care, so outside of just the primary care clinic or inside even, being able to communicate with everybody in a way similar to this diagram perhaps leads to higher levels of satisfaction for both professionals, for staff and providers, as well as less burnout, but also higher quality of care, which comes back to patient satisfaction. Patients are actually shown to be more satisfied when they're engaged in care as well. We want to talk about privacy as well quickly. If we look at the breach notification decisions published by the OIPC in the last 2 years, there was about 100 of them. You can see what happens here. Cyber attack, ransomware, which is a form of cyber attack. So a lot of cyber related incidents, but also mistakes. And Stanford University published a study last year that showed that 88% of data breaches are a result of human error. So we need to be careful about that stuff and put things in place that block those from happening. Things like using CC instead of BCC, misdirected emails, doing recall and stuff like that. We'll talk about that in a little bit. Phishing, all of this stuff, SecureMail helps you prevent automatically, rather than just telling people, hey, don't CC instead of BCC. It actually is not possible in SecureMail. Patients are always BCC'd. Mark, do you want to talk a bit about some of these risks?
Yeah, sure thing. With traditional old-fashioned email, which you shouldn't be using in healthcare settings for any kind of healthcare data to begin with. But the other problem that happens is even if you're sending a message that is not necessarily containing any sensitive healthcare information, it's just a notification. If you send that message to, let's say, 20 patients and inadvertently put every patient's email address in the CC field as opposed to the BCC field, then now every one of those patients now knows who every other patient is on the list. And although that seems trivial, it does constitute a potential breach of information because you're revealing information that shouldn't be. So as Jeff said, with BrightSquid SecureMail, that can't happen because automatically patients are BCC'd and there's no way to get around that. Phishing with a PH, as you all know, is the method that bad guys use to trick people into doing things. Usually it's clicking on a link or downloading a file. Phishing just doesn't happen in BrightSquid because we are a closed by invitation only system. SecureMail has ways of keeping the bad guys out, and so there's no one in there trying to trick you. And if you ever do suspect that someone sent you a SecureMail message that is an attempt to fool you, let me know and we will take care of that immediately. Fragmented data, this is just the idea of not everyone having all the information to make the best decisions. So by using SecureMail to communicate information about patients and their path for care, we can better inform everyone and make sure that nothing is left out. Ransomware, same idea as phishing, because we don't have those bad guys in our system sending information that could be harmful. We can simply prevent the accidental clicking on a ransomware link that someone would do if it was received through traditional old-fashioned email. We have read receipts and message recalling. So if you do ever make a mistake, and goodness knows I've done it myself, I go to send an email to Jeff, and without paying too much close attention, I hit tab and I hit send, and immediately I know that I sent the message to the wrong Jeff. So with Secure Mail, we can recall a message, and you can also see the read receipt to determine whether or not the wrong Jeff, in this example, has even read the message. I know traditional old-fashioned email, some systems do offer message recall. Those systems are very unreliable and don't work most of the time. Within Secure Mail, if you use a read receipt to determine if the message has been read by the wrong person, and it hasn't, and then you recall it, you can rest assured that that wrong person will never read the message or have access to any attachments you may have sent to them. Therefore, you can avoid a privacy breach by using those two tools in BrightSquid Secure Mail. All of the messages and accounts in BrightSquid Secure Mail are auditable, so you can keep track of who's logging in and who does what. And those are all managed by every user having their own individual user account and discouraging the use of shared usernames and passwords, making sure that everyone is acting as themselves within the BrightSquid community. There is an opportunity in some email clients to, quote, secure a message or encrypt a message. If you forget to turn on the privacy switch, the message is sent in open unencrypted email, and that can be problematic. Not to mention that some of these so-called secure or encrypted systems, while they may have security and they may have encryption, they may not necessarily meet the compliance requirements here in Alberta, across the country, or into the US.
The access auditability part is really key, and it's a requirement for compliance. We actually worked with clinics within the CFPCN to build that functionality of the shared inbox. You can have multiple users logging in with their own IDs, but they're still managing the same inbox on behalf of the clinic, just like they would answer the phones on behalf of the clinic. Back to some of that stuff, when we talk about mistakes being a big part of privacy breaches, eliminating excess manual effort is a big deal for us, right? How does that fit into the life of a clinic?
Well, everything is kept digital within Secure Mail, so that's one of the biggest things. Some say they want to eliminate paper in the clinic entirely. I think we're still a few years away from that. But if you can reduce the amount of paper that's being used, that also reduces the amount of printer ink and printers and fax machines and all those expensive devices that we have. You can reduce the cost of that, but also the frustration of using a bunch of different systems. I've actually seen more than one clinic where they will print something and then scan it and then shred the original piece of paper. If everything stays digital, you can just send digital files directly through BrightSquid Secure Mail. And those can be PDF documents, Word documents, Excel spreadsheet, any document you can imagine can be sent through BrightSquid Secure Mail. And you don't have to fold it up and put it in an envelope and lick a stamp and all those things that no one likes to do. Just send it through Secure Mail. How many times do you have to refax a message to someone because their printer fax machine was out of paper or offline or something was wrong with it? Reducing the amount of phone calls that you need to make during the day. Your office is probably open between 8 to 5, Monday to Friday. But if you try to call a patient at 2 o'clock on a Tuesday afternoon, they're not likely to answer. Even if it is their cell phone, most people are at work during those hours. If you send that person a secure mail message, they can read it and respond to it at their convenience. And the list goes on and on. So we can streamline the whole onboarding part. I talked about the secure online forms. That's a great way to collect patient health histories. Send them a secure mail message. They can fill it in at home with a couple of mouse clicks and send it back to you, as opposed to them filling it in while they're in the waiting room with a clipboard. And it's just less efficient, I think, doing it that way. So it's better to get that onboarding information ahead of time, which gives you time and your clinicians time to review the information prior to meeting with the patient for the first time.
The point about refaxing, again, we use fax machines and we accept at a certain point that it's not going to go through and we're going to have to resend it. That is not a concern with Secure Mail. Once it's sent, it's sent, and you know that it's been delivered. And you can go and, like you said, Mark, look at the read receipts, which is great for patient communication because it adds accountability, right?
Yeah.
So, hey, oh, the patient hasn't sent me that form back yet. I can go and look and see if they've seen the message. And if they haven't, I could resend it, or I could follow up and say, hey, you read the message, but you didn't finish the form. We need you to submit that before your appointment. The end result of all of this is we're getting rid of extra work. We're getting rid of spending extra resources. Our operations costs, our overhead, our consumables go down. A lot of clinics save at least $500 a month. I had somebody come up to me at a training that we were doing for privacy clinics that said, I am saving $1,000 a month because we're no longer buying stamps and we're not printing out images anymore and sticking them in a 9x12 envelope for the mail. A ton of savings, even just in that context. When we talk to medical clinics, they're spending somewhere between $200 to $300 to $400 a month on mail costs. And that can all go away with Secure Mail because any file can be sent. Clinics have told us they save 18 hours of administrative time a month. On top of that, all the privacy breaches that get prevented. So privacy breaches are expensive. Something like ransomware can cost hundreds of thousands of dollars to recover from. We've worked with clinics who have been hit, and the ransom demands start at about $300,000 to get your data back and prevent it from being leaked on the internet. So that's before any fines you might incur. That's before working with your IT team to do that. That's before any lost time because the clinic can't function because your EMR is frozen and locked up. All that kind of stuff can be very, very expensive. Not to mention even just a simple privacy breach, somebody's time away from their regular duties as a privacy officer working on some sort of remediation or investigation for the breach. There's a lot of good cost savings, both from financially as well as just staff time that we can repurpose.
We've introduced a lot of enhancements that have come directly from our end users, a lot of them from the CFPCN. So, being a single channel for communication for patient and professional user communication. SecureMail was originally launched for clinic-to-clinic communication for two healthcare providers to have a chat, not a chat, but a discussion around healthcare information, as Jeff mentioned, with the radiologist sharing diagnostic images. We introduced the patient communication probably 4 or 5 years into it, and that quickly became the most powerful or the busiest channel, I suppose, was messages being sent between clinicians and their patients. The shared inbox, as the name obviously suggests, is an inbox shared amongst multiple users on a team. That is a great collaborative tool to make it easier for the communication to be with your clinic as opposed to with a specific person in your clinic. You can, of course, send very, very large files through Secure Mail. Traditional old-fashioned email typically allows files up to about 50 megabytes in size, whereas within Secure Mail, you can send 500 megabytes at a time. So that could include things like CT scans, super high resolution diagnostic images, and unlike traditional old-fashioned email, your attachments won't be rejected on the other end if the recipient's inbox is already too full. The secure panel messaging, I think I touched on earlier today, but just to reiterate, that's the concept of sending a large bulk message to a number of people from a template. So that could be something I know I talked about this already, but I'll say it again for screening patients. So if you want to have everyone thinking about being checked for diabetes or some other condition, that bulk messaging would allow you to notify or reach out to 1,000 patients at a time, for example. And we also offer training courses. So built right into every BrightSquid account is online training. Some of those training courses are how to use Secure Mail, but some of them are ways to make your clinic more private and protect your privacy and reduce the opportunity for data breach.
The other big thing that SecureMail offers, that I mentioned at the beginning, is compensation. So there are billing codes that apply here. Or 301S is direct to patients or doctor to patient for $20 on 14 of those a week. So that's the stuff that can be done quickly. I know some doctors like to try and do phone consults with patients during no-shows or something, but it's something real quick and easy to do during no-shows. We've got some webinars on how to do that, and we'll send out the sheet about how these work, but you can also look up in the Fee Navigator. When you add these up, particularly with the eConsult code, which has a response code for specialists. If you want to just send a question rather than do a transfer of care, not have your patient wait for 6 months potentially just to find out they're in the wrong waiting line, you can send a question as an e-consult, and that's billable rather than just a fax. You can send it through secure mail and earn compensation for that, as you should be compensated for the time for managing those patients. So it adds up to quite a bit. So there's almost $30,000 easily just doing 10 e-consults a week and 14 messages to patients. So it can be quite a useful tool. Just to go through quickly the interface, if you're not super familiar, we're pulling out some of the things that we've been talking about. There's the shared inbox for team administration. You can include up to 20 recipients per message. You can see the secure mail is very familiar. It looks like email. It's easy for patients to figure out and use. There's the templates selector up there at the top. Also, the message content is always secure and encrypted, and the data always resides in Canada. You can add the forms that Mark was talking about. So there it is. If you get us to build one, there's pre-existing forms, but if you wanted a custom one, it'll be there for everybody in your clinic to use. And attachments can be 500 megabytes each with no limit. So you can have as many 500 megabyte attachments as you need to send on each message. Read receipts in the sent folder, so you can go in and see if and when somebody opened and looked at your message, which is very helpful to know. There are 12,000 and more healthcare professionals in Alberta with secure mail accounts, and you can find them in the directory if you need to chat with people or send information or ask for information. As well, there's over 350,000 Alberta patients. Many of them also have their secure mail account integrated with their My Health Record account, which is the provincial patient portal. The box of boxes, I call it, that navigation up in the top left, is where you and members of your clinic can access the privacy breach prevention training that's available in your account. Really quickly, I just want to address some of the EMR add-on questions. So EMRs, some of them do have secure messaging. Oftentimes they're built to check a box. We'll say it's afterthought software, something that is tacked on at the end. It's not well thought out. Usually, it's not good across the circle of care. You can't use it to communicate with everybody. It's often a patient portal maybe, or just some simple patient messaging. That's the kind of thing that contributes to the patient portal fatigue we talked about, where patients have too many things to manage, one for every provider, and they don't know where to go. If they're using secure mail with everybody, it makes it that much easier. The other thing about these EMR add-ons is there are none of them that have accepted PIAs with the OIPC. I know some are working with the OIPC to get to that point, but they haven't reached it yet. And we get limited file size. So it's an okay solution for some cases, but it does not give you that fulsome coverage across the medical home. So lastly, before we kind of get to a couple of questions at the end, you do qualify for a discount that's been negotiated with the CFPCN. So instead of $57.50 per clinician per month, it's $30 per clinician per month. So when you look at the compensation that's available at $30,000 for the year, $360 for the year for the clinician is 1% of what the revenue opportunity is. Email Mark's team if you want to get that set up to keep your subscription going after the end of March this year, and have all of these benefits. Mark, we do have a couple of quick questions that we want to get to. Can you talk about, what happens if patients just want to use email? That's one question we have here.
Yeah, sure. I mean, anytime you invite patients to use something new, in this case BrightSquid Secure Mail, there's going to be a percentage of people who are resistant. That's just the way it is. Whether it's Secure Mail or some other service that you're trying to use with your patients, people will sometimes say no, thank you. And that's fine. But honestly, the number of flat out refusals to use Secure Mail is extraordinarily low. When it does happen, it feels like they're representing everyone. And that's simply not the case. One person saying no, thank you to BrightSquid should never be considered to be an indication that no one wants to use BrightSquid. Secure Mail is heavily used by Alberta patients and healthcare providers, and one or two people saying no thank you is just to be expected.
Yeah, I will say overwhelmingly the feedback that we get from clinics is that patients are very excited to have a way to communicate like this. And you gave the example, Mark, of patients work, right? And they can't always answer the phone during work hours, but they can address a message when they get home, or they can send a question at 9:30 at night if they just have a somewhat benign question that's not urgent. And SecureMail does tell patients that this is not meant for urgent communication before something is sent. So patients actually have to check a box saying, yep, I'm not in immediate danger, and if I am, I'll go call 911. So they can't send a message until they acknowledge that. And the other thing that people are doing that we didn't really talk about, but you can go back and look at the webinar, is the pre-sending notice that we have available that you can use to explain to people who are sending messages in advance of that how you intend to use SecureMail, how you'll respond, and that sort of thing that really helps shape patient communication and help them participate as a functioning member of their team.
Yeah, setting expectations via that message notification can be really helpful. And it also addresses one of the other issues, which is doctors are excited about the idea of having SecureMail, but they don't want to be chained to their desk on weekends to have to deal with messages from patients. And that too is something that's managed by our pre-sending notifications as well as the shared inbox. So if you're a physician and you're concerned that, oh, if I use SecureMail, I'm going to be responsible for dealing with messages from my patients on Sunday afternoons, come talk to me. I have a solution for you.
That brings us to the end for today. Thanks, Mark, for coming along, and thanks everybody for tuning in. We will send out the recording as well as the information sheet that details more information about the billing opportunities and those fee service codes for SecureMail.
All right. Thanks, everyone. Have a great day.